When I came to WMC, I was the Chief Nursing Officer in 2013, and at the end of 2015, I took over the interim role for CEO, ultimately accepting that position in February of 2016. So the last 7 years I have been CEO. I always say that every CEO that served at WMC had an important piece of our history. We had a long-term CEO that was able to save money around 2010 when we decided to build a new building to keep up with the momentum of private patient rooms with every other hospital. And that really transformed the way we give care here. Then we had a CEO that was really interested in making sure that we were providing the right care, so the best quality with the right specialists. And so we set that groundwork with bringing in some other partners to help us really advance our abilities. And I think that we've continued to do that. In my time, we acquired the physician practices here in town, which allowed us to have more care coordination across the continuum. But we also have been able to support those practices to recruit new physicians to the area. So we are laying the groundwork for a flourishing medical community for the next 35 years.
I really believe that seeing the hospital grow and develop, the number of doctors who have come to the hospital, the specialists that are here, I think that's the most rewarding thing that we have seen at the hospital. The tremendous operations that are being done here, the cancer treatments that are being done, the fact that we have the complete trauma center for strokes and heart attacks. That's really something for a community hospital. Each one of the administrators saw something in this hospital that needed to be improved. And I think they have brought that, and I have watched that over the years.
Certainly the growth of the hospital and bringing so many wonderful new physicians in so that we have a lot more areas that people can use in place of having to go to the city. That's been a wonderful, wonderful thing.
Even after working here for 20 years, sometimes when I come in, I get lost. The hospital has grown so much. So many more physicians now, specialists, more opportunities, more employees. A lot of times at the board meetings, we are fortunate to have a manager from another department come and give us a little rundown on their department, what's been going on. And it just amazes me how much intelligence there is in our hospital.
We have really committed at Western Missouri to recruit quality physicians to this area. We are fortunate enough to have been successful in many recruitment efforts, and I think it is largely due to the nature of this community.